So anybody who has a brain
Yeah.
can go through a mental health problem.
Mm.
So there are some illnesses that are more with kids,
Yeah.
because of the risk factors with kids, and you may not find them in adults. And some too you can find in adults, you may not find in kids, but everybody through the spectrum, from the womb till they die, people die. So far as you have a brain, you have social interactions and all that, you have mental health problems. Really, mental health issues, majority of the time, they start even before 14 years.
We are working so hard to bring you the voices that matter and to tell the most inspiring stories. Please subscribe to our YouTube channel to become part of our growing community.
Hello, lovely people. Welcome back on another episode on Time with Julius. And we have here with me Dr. Alpha, who is from the Ghana Psychology Association. Okay, thank you, Mr. Alpha. But before we get into it, could you introduce yourself to the people?
So I'm happy I'm here and you're doing a good job. That's why I came.
Thank you.
You're doing a very, very good job. So that's good.
Thank you.
And that's a very, very good feedback. And my name is Dr. Isaac Nimanata, and I'm the PRO for Ghana Psychological Association.
Okay.
Then the director of the University of Professional Studies, their medical directorate.
Okay.
But I'm a medical doctor and clinical psychologist.
Oh, okay.
Yes.
We are honored to have you on this episode.
Thank you.
Yeah. So what made you get into psychology?
I think generally it's the neglected aspect of health.
Okay.
Health is four-dimensional: physical, mental, social, and spiritual, right? So if you look at when healthcare services, in terms of physical, we're doing well. So we have a lot of clinics and hospitals who offer some care, on physical health. So hypertension, diabetes, the surgeries, the cancers, those things. Then the social issues are there, and government has policies generally, but not too strong.
Yeah.
But we are doing well.
Okay.
Then you look at the spirituality aspect of health. There are all kinds of religions and churches and religious bodies around that are really doing well in terms of helping people deal with their spiritual issues. Okay. What seems to be missing, in the whole equation is mental health. And so there are a lot of people who may have mental health issues. They don't know that they have it. They don't even understand what is happening to them. They don't know what to do, where to go to. And if you look at generally policies on mental health, Ghana is doing well if you compare with other countries, but it's largely neglected or understated. And because of the stigma relating to mental health issues, people really do not pay attention to that. So I really felt that that area is a gap. And again, too, I have a lot of interest. Growing up, I have a lot of interest in mental health. And so why not make a difference in that area? So that's really some of the things that really pushed me.
Okay. Yes. All right. Thank you so much. And so what is your role as a clinical psychologist? Because a lot of people get confused with psychiatric or therapy and them stuff. So as a clinical psychologist, what is your actual role?
So there are various levels of mental health management. Okay. And when you look at mental illnesses, there are various causes, risk factors, management, to be able to provide that total care. So if you look at the hierarchy, I won't use the word hierarchy, but the different types of mental health professionals. We have the psychiatrists who virtually sit on top of the food chain, if I have to put it that way.
Yeah.
So they are medical doctors who go to do a specialty in psychiatry.
Okay.
Right. And psychiatrists are likely to deal with the, in quotes, physical aspect of mental illnesses.
Okay.
Right. Though they do everything else, but they are likely to be the ones who are likely to prescribe, look at the physical dimension of illnesses, mental illnesses, and try to fix it. They do therapy and all that, but that is their area. So they are likely to be referred to for medication. They may deal with extreme form of mental illnesses that really affects a person's functioning. Right. Then we have the neurologists, we have the neuropsychologists, we have the clinical psychologists, we have the counseling psychologists, we have the counselors. Even with the counseling, we have different levels. We have the professional counselors, we have the lay counselors. The lay counselors are a lot. They are the ones you're going to find in various churches and some organizations, the lay counselors. Then we have the mental health nurses.
Okay.
They are nurses who have been training in mental health. So all those levels, and each one of them have what they do. But apart from the neurologist, the neuropsychologist or psychiatrist, they may go more into the physical aspect of mental health. But the psychologists, all the psychologists and the counselors are likely to deal with, I use the word we have soft copy and hard copy, right? Issues around mental illnesses, so if you look at depression itself, they are likely to do the therapies with that.
And is that the hard copies as well?
No. So that's the soft copy.
That's the soft copy. Okay.
In terms of the talk therapy and stuff like that. And there are all kinds of other therapies.
Okay.
But the psychologists and the counselors, they are likely to go into the therapy aspect of it. Then in terms of the other management with drugs, prescription here and there, you may find the psychiatrists and stuff. They do therapy, but they may not be involved because sometimes because of the numbers. So they are likely to refer to see the psychologists and the counselors to be able to deal with the issues. Maybe someone has marital problems, parental issues, conflicts at home, those things. There are all kinds of therapies, for that. But the psychologists also are not prescribers.
Okay, they don't prescribe medication.
They don't prescribe medication.
They don't diagnose.
They diagnose.
They can diagnose. Okay.
But there are different levels of diagnosis. They are likely to refer to the psychiatrist for some other diagnosis with bipolar, schizophrenia, those things. Even with depressive disorders, they can manage. But theirs is towards more of the therapy bit of it, right? Then again, so psychologists don't prescribe.
Okay.
So they are likely to refer to a normal medical doctor or the psychiatrist to prescribe because they have the training for it. But now we have others who are bridging the gap between the psychologist and the psychiatrist. Okay. They are the medical professionals, the medical doctors who also go into psychology.
Okay.
So they also have the capacity to prescribe because they're also prescribers. Okay. And so I am on that level.
Right.
Where you have a medical doctor going into psychology.
Okay.
To be a clinical psychologist. Usually the normal, in quotes, clinical psychologists, they go to Legon or UCC or any of the universities, they go do something in education or psychology as first degree. Then they do masters in clinical or counseling psychology or counseling. Then they progress to PhD on that level. Yeah. But they haven't gone to study drugs and drug prescriptions. So they cannot prescribe.
Okay.
But the doctors who go into clinical psychology, they can prescribe because they have the training.
Okay.
So they're dynamic, but there are a lot. The various, we even have industrial psychologists or occupational psychologists who deal with work-related issues and the psychology with it.
Okay.
So they are also there.
Okay. And these agencies are all in Ghana here.
Oh, they are there. They are here. We have child psychologists and stuff, but in Ghana, child psychologists are not plenty. I don't think we even have a child psychologist in Ghana. Usually it's the clinical psychology and counseling psychology they handle, and the counselors. They handle some of these other issues. Yeah. Then the neurologists too, they are also there.
Yeah. Because talking about child psychologists, do you think children get depression?
So anybody who has a brain can go through a mental health problem. So there are some illnesses that are more with kids, because of the risk factors with kids, and you may not find them in adults. And some too you can find in adults, you may not find in kids, but everybody through the spectrum, from the womb till they die, people die. So far as you have a brain, you have social interactions and all that, you have mental health problems. Really, mental health issues, majority of the time, they start even before 14 years. So around 14 years or about 25 years, you realize majority of the issues begin around that time.
Yeah.
So kids have depressions, kids have anxiety disorders, kids have all those things.
Because the reason why I'm saying that is because, this is Ghana, we're from Ghana, and we have this perception about, as imagine if you're like a 14-year-old boy, go to their mom and say to their mom, I'm depressed. They will never take them seriously, because I know how these things are taken seriously outside Ghana, and I know how it's not we don't really take it serious. Do you know what I mean? That's why I ask about, because a lot of people think if you are a child, you can't get only adults that have responsibilities, can get depressed. So it makes people, and we are kind of diving into the stigma aspect of the psychology and stuff. So it doesn't make people or the children open up to their parents, because it's either you being beaten up, like, what do you know about, or they will think you're talking, I mean, there's something going on, with you spiritually, so that's why I ask you that, because I feel like we need to, especially parents, we need to open up to our children, so they can also open up to us.
But based on this point you've made, let me say that there are about 5 different stages.
Yeah.
And each stage has its own risk factors for mental health problems. So we can put it, let's say, from 0 to 12, 12 to 19, 19 to 40, 40 to 65, then above 65.
Okay.
Everybody and what influences them. So, for example, between 0 and 12, they have issues that are risk factors for mental health problems. So right from the womb, damage from the womb, genetic issues, or labor problems, or mother is unwell during pregnancy, things are not done well. By the time the child comes out of the womb, their brain is damaged. So there are some kids, social skills is a problem, intelligence is a problem, sometimes even movement is a problem. They have delayed milestones, even speech is a problem. They are all mental health issues.
Right.
So kids who come with autism, attention problems, intelligence problems. There are some of us in our schools, you may not even find, there are some students, no matter what you do, they will be last. They may be average. Sometimes it's not that they are not studying. Their brain just cannot pick what they are being taught. Right? Sometimes social interaction is difficult. Now, we even know breastfeeding, not just the breast milk, but emotional development starts even with breastfeeding.
Okay.
See, because whilst you carry the child, it's not just the feeding, but that interaction, the child's tiny brain interprets that as love, warmth, care. The emotional development starts around that time. You see, so there are some adults who are emotionally not developed well just because probably they were not breastfed. See, and that is why babies may not even go to strangers. You wonder how a baby with a tiny brain is able to even identify their parents and stuff. So all those interactions are there. And again, when you buy toffee for a child, right, there are problems around the basic things of life: care, love, warmth. So you carry a child, they interpret it as love. If you don't carry them, they don't feel loved. They can set off some depressive problems. For example, you go to town, you buy toffee for a child. The way they're excited just because of toffee, it's not just the toffee, but they are pairing that act with my mother loves me, my father loves me, right? Sometimes a child does something, you don't allow the child to explain themselves, you beat them. Maybe it's not their fault. They are internalizing those pain. You neglect your child, you go deposit them with grandparents. You are not there for. I have clients whose problems started when they were 3. Okay. But parents didn't actually know that whatever they were doing to that child was affecting them. Right? They go to school, sometimes in school, bullying in school, comments from teachers. There are some schools who even grade students, A, B, C, and the C students are the average ones. The B are a bit more intelligent than the others. They are super intelligent. Imagine you going to school and they've put you in class C. And teachers relate with even those students differently. So there are all kinds of things. Sometimes I even wish the teachers should also be graded. So that everybody knows the class C teachers to find out whether it's even nicer. Right? Playing. Kids who are not playing are not growing. You'll be shocked that something as simple as play, kids playing together, right, can serve as a risk factor for mental health problems. Right? So kids have what influences their mental health issues. The moment they cross from 12 to 19, also their issues is around acceptance and understanding. Every adolescent's brain is growing so rapidly. Now they want to be independent. They want to form their own identity. They want to, form their own worldviews. So now before 12, they will come and ask you questions. Now after 12, they no longer come to you. They are wearing what they want to wear. They are going where they want to go. Now parent conflicts will start. But every adolescent wants to be understood.
Yeah.
Because they've reached a point where the transition between childhood to adulthood, they want to do things themselves. But if parents don't realize that you don't dictate to an adolescent, you discuss with them. So instead of saying you're under my roof, you do what I like, why not have a conversation with them?
Yeah.
You know, every SHS student understands what they want to do with their lives already. They know the courses they want to read. They know their interests, whether they want arts or finance or something. But parents will actually force those things on them. I'm paying the fees. You do what I like.
Yeah.
So all those things, before you realize, they don't go to parents when they have problems. They rather go to friends. And that's where peer influence will go up. You know, then the moment you cross 19, between 19 and 40, your issues is around purpose and networks. Where am I going with my life? Who would help me? Yeah. And that is why career, education, relationships, and those things become so paramount in those ages. So every stage and its own risk and problems. So that is why you may find kids who are depressed, not because they don't have any responsibility. Their needs are different. What triggers them is different. You'll be surprised that even comments, screaming at a child, insulting a child, using their body parts against them, may be their source of, it may not be finance because really they don't have money. They don't even know someone provides for them. But all those things become the risk factor for mental health issues and the triggers for mental health problems.
Because I feel like most parents panic at that age when they reach their adolescence. They panic, because most will be thinking, if I have to be firm on the child, I have to start hitting them, I have to start beating them, because if not, they will turn out stubborn, not realizing that it's actually their problem for not understanding the child, for not allowing the child to come closer to them, to open up to them, because from childhood, most parents, like most children, are even scared to go to their, their parents for advice or for any information, as you said. So I agree with you so much, because that's when people tend to go to their friends and they will be influenced to do all sort of things, So I feel like parents should. I feel it's gonna be. Do you think it's gonna be hard for parents to understand, this, that, or create awareness for parents?
Yeah, you're right. I think that a lot of parents were not parented well.
Yeah.
So they just don't know what to do. See, if you find a parent who is loving, caring, understands the child, and relates with the child well, it's likely they've experienced it before. It's likely someone has shown them a certain kind of love, care, and understanding. Unfortunately, a lot of parents never had it. They never understood what it meant. And the fact that someone has given birth does not mean they can be parents. So I think that is where the problem is. And unfortunately, when it comes to most of these premarital counseling and stuff, it's so short that they don't even talk about parenting the way it should. So usually for the first, second year of marriage, someone has a child. What do you do with a child? What do you do?
Yeah.
Another human being has to grow. So a lot of parents don't really know how to parent. And again, a lot of parents are going through so much trouble that the peace of mind and the right emotional state to extend to their kids is not there. So if they're having financial problems, it's likely to be carried on to the if the marriage is also not going well, now the kids become the channel through which they express their anger towards each other. And that damages the child.
Yeah.
And imagine that child growing up in that environment and they grew up and also have kids. It will be difficult.
It takes only a few people, because I'll use myself as an example.
Yeah.
I didn't have a good relationship with my dad, growing up, because there was a lot of things like, physically, mentally abuse and all that, but we kind of accepted that okay, as a Ghanaian boy, you have to go through that to make you strong. It could have made me weaker as a person, but I thought about it and I kind of channel it to be a positive thing, because then I look back, everything that I went through as a child, I look back and then say to myself, if I've gone through, that with my dad, for instance, then I can go through it. So maybe I was lucky to be able to channel my anger, into a positive thing. But not a lot of people can do that. You know what I mean? And I've got two girls, right? What I went through as a child. That's all I knew. But then I was able to think, okay, I didn't like the way, what I went through as a child. So I'm gonna try and bring my child up differently, So I always allow my like she's only 5, but you'd be surprised the things that they learn at that age, even 2 are free, because they watch things, So back to what you said, parents go through a lot, sometimes, to be able to extend their love to their children, and not because of what they went through as children. That's what
Yeah.
they know. That's all that they know,
Yeah.
So they have to. That's why they feel like they have to be firm. They
Yeah.
have to hit the child, But hitting children. Do you think it's advisable for parents to hit their children?
So any discipline
Mm.
that is not done well will become traumatic. Right? What it means is that you don't discipline your kids out of anger.
Okay.
Sometimes, even if they do something wrong, you don't respond immediately,
Mm.
because you're likely to discipline them based on how you feel, not based on the fact that you need to correct them. Right? So sometimes you need to pause and think about it in the first place to see whether even what the action you want to take, is that the right action to instill that discipline. Unfortunately, there are 3 levels of correcting a child. The first is called training. Training is a form of correction.
Okay.
So you teach them how to say thank you, how to wash, how to sweep, how to say no, how to say sorry. After teaching them, the next step is when you correct them
Right.
for the error. And correction, means that, you were supposed to say thank you. You didn't say thank you. And because you didn't say thank you, this and this is what happened. So please, next time, say thank you. Correction should be repeatedly done. After correction is not taken, then you can institute punishment.
Okay.
And there are different levels of punishment. Most of the punishment we know in Africa is actually abuse.
Exactly.
See, it's actually abuse.
Mm.
So you can actually even spank your child in a way that is not abuse.
Mm.
You see, there are some spanking that you know that, no, this one, no, it was just too much.
Mm.
You see. So until the tool is in place, you cannot institute punishment. Unfortunately, a lot of parents, they have not taught. They have not corrected. They just go ahead and do whatever they want to do. When you do that, your kids will become more afraid of you. May not see that daddy is correcting you, but daddy is really damaging you. And when people go through traumatic experiences, there are 2 paths that they may pass. One path is where you are now, where, for example, it is a positive path, where you learn the lessons. You receive probably some help. You will now say, I won't do it to other people. You become more productive and responsible. That is one path. Some people go through trauma. So, for example, they are beaten, raped, abused, whatever, right? They may go on that path you've passed on. The next path is the negative path of distraction, where they themselves either destroy themselves or destroy others. See, where they internalize the pain. They never heal from the pain. They either become withdrawn or they become social misfit or they go into some social vices. Some people become abusers because they've been abused before. Right. Some people who have even been raped before, unfortunately raped before, they can go on a path of, sexual deviance and destroy others because they didn't heal. So all of us respond to trauma is differently.
Yeah.
Based on how we took the trauma and based on how we healed from the trauma. Thankfully, you went on a certain path. And if you look at every adult that's gone through certain challenges as kids, but how the path we choose affects our outcome significantly, right? But unfortunately, in Africa, a lot of the discipline is abuse.
Yeah,
all of us have had some experiences in the past that, and you know that this one, and particularly people feel kids shouldn't talk. Sometimes allow your child to defend themselves.
Yeah.
Why did you let them? And sometimes you'll be shocked that they were thinking like a child. That is why they did what they were doing.
Yeah.
And obviously, a child is a child.
Yeah.
Every child writes on the wall.
Mm.
You won't find anybody who is giving birth and their kids who write on the wall. Why do they write on the wall? Because they go to school and they see teachers write on the wall. But their brains are not developed enough to tell the difference between a writing board and a normal wall. So, for example, if your child comes and you see them scribble on the wall and you beat them, in their tiny brain, why is daddy beating me or mommy beating me? Because they go to school and someone is writing on the wall and nobody beats them.
Yeah.
You kill their creativity from there. And usually when you look at the things they've drawn on the wall, it's nice, sometimes nice things, so that is how they engage the world. But unfortunately, a lot of parents haven't come to the attempt to understand that kids are kids.
Yeah.
And sometimes until you correct them, you wouldn't have helped them.
Yeah.
And sometimes instead of beating them for writing on the wall, why not teach them that, this is a wall, it's not a blackboard, it's not a writing board. Now, even create a writing space for them. Sometimes you can even do this the small writing board and piece and say, and you'll be shocked that they will never write on the wall.
That's so true. They would never.
You'll be surprised.
They actually listen. They actually listen.
Yes.
And also, one thing as well that I realized about Kate as well is, to me, there's no stupid question. I give them the opportunity to ask anything. And I have to answer. Sometimes I'm not even in the mood. I have to answer to her. Because I feel like if you don't answer, then next time they're going to be a little bit hesitant to ask you a question. Because you are creating a space where they are free to come to you and talk to you about anything.
Yes.
Everything.
Yes. Particularly the adolescent years.
Yeah.
And between the age of 6 and 12 is the stage where it's time for questions. Before 6, the understanding their world, understanding of the world is limited. So you need to show them pictures for them to understand. So if you talk about a doctor, show them a picture of the doctor, orange, show them orange. But the moment they cross 6 to about 11 years, the brain is developing so rapidly, they can ask 1,001 whys. Even you say go and where, they say why. You think that they are being disobedient. No, their brain wants to understand. You say write this, they said why. Eat, why. Go and sleep, why. You think they are being disobedient. No, their brain has developed to understand things in another way. So if they ask why and you don't understand them, you shut them down or you beat them. They will shift from asking you why, but accepting everything you say. Now, when they go to school, they will ask their teachers, they will ask their other colleagues. So when a parent is telling their kid something and your child says, my teacher says this, it means that now you are no longer their primary source of information, someone else's. And if that relationship is not built in the adolescent years, that's when the rebellion begins. Now you want to advise them, they won't listen.
Exactly.
Because you were not there.
You're not there. That connection.
Yes, it wasn't there.
Yeah.
Yes.
Okay, let's move. I think we need to do this from time to time because mental health is very broad. So we can't talk about everything today. And time is not even gonna permit us. But let's talk a little bit about grown-ups, like adults, how males and females deals with mental health. What's the difference between how a male will deal with mental health compared to a female?
So biologically, we're different. Males and females are totally different. A man can never be a woman. A woman can never be a man.
Okay.
Unfortunately, in our society, we're trying to create a certain system that is not compatible with our uniqueness.
Okay.
Women are essentially different. Men are essentially different. It's okay to be a woman. It's okay to be a man. None is superior. Men are not superior. Women are not superior. We are all unique. That uniqueness gives us a certain advantage. And that is how the world goes on. Imagine if the world was full of men. It would be a boring place. Imagine the whole world was full of women. So we need women to be women. We need men to be women. In terms of dealing with situations, even our brains are different. Right? The right side of the brain is more active in women than the left side. The left side of the brain of men is more active in men than the right side. Emotions and emotional things is more specialized with the right side of the brain.
Okay.
The left side is more analytical reasoning and those things, technical things. And that is why men are more solution oriented. Women are more emotion oriented. It is okay.
Mm.
Women are likely to talk about issues. They are likely to go seek help. Men are likely to analyze things themselves, try to fix it themselves. You see a man go seek help, it means that they are at their wit ends. They've tried everything else they can try, and it's not working, and they want to go and seek help. So typically, you may find women go talk to their friends. Women would like to express. Women are more expressive. We are all emotional, but women are more expressive. Women are likely to go seek help from a professional. Men are likely not to do that. So those are the differences. And it's okay to be different. You know, the only thing is that anytime you realize that you're overwhelmed or you realize that this is affecting your functioning, you just have to go speak to a professional. When guys meet, we are likely not to talk about our issues. We are likely to discuss some business deals or past year we are going here, we are doing this. Women are likely to meet and talk about themselves. You go to the salon, it's a whole environment.
It's actually a therapy session.
Yeah, therapy session for them. But a man goes to the saloon and we are likely to just sit there, sometimes not even say anything till they are done. Right? So we are essentially different, and it's okay to be different. You know, the only thing is that a professional approach to things is always protective. Because some of the mental health issues are very, very sensitive. That you better off talk to a professional than just an ordinary person.
Yeah. So, I mean, you said a lot. And so, you know, with men, you know, I read this research, but I mean, I stand to be corrected. There, like, out of 6.6 people, I mean, out of 100,000 people, 6.6 of 100,000 people go through depression, and about almost 2,000 are men, and about 200 are women. You know, when people that go through depression, that's why there's like a lot of suicide, you know, incidents, you know, among men than women, because men, as he said, I read this story, or I think it was a movie where there's like a group of friends, you know, that has been together for, like, male friends that has been together for, you know, over 10 years. You know, the next friend they had, and they do everything together. They go to, watch football, you know, they go to parties, you know, they are very, very close friends, and they are always together. And then they had one of them committed suicide. And then they realized they were, and it came out that men don't really talk about personal stuff to each other, you know, because of that stigma around, as a man you have to be strong, you know, as a man you can't cry, you know, you have to deal with it, you know, just nip it in the back and, you know, deal with it, you know, whereas the women are always open to each other, you know what I mean? So I'm just saying, I feel like men should open up, you know. And why do you think men are not able to open up to each other or even seek help?
I probably generally men really are solution driven. They would want to be seen to fix problems. Generally, that's our drive. Anytime we wake up, we're thinking about what to fix. You know, I don't think a man would get up from bed and think about what is my wife doing or what are my kids doing. They are really thinking about the house, the building, the next job. You know, our brain works differently, right? So men wouldn't want to be part of the problem.
Right.
You see, we want to fix problems and not be part of the problem. See, and again, you talked about societal perception and expectations. You know, imagine a man goes to a consultant and is crying. It looks, you know, it looks, you know, and so we really won't seek help, right? I'm a man. I know what it means to try to talk to someone about your issues. Men talk, but they talk to few people, and they talk to a safe space, where you'll not be judged, you'll not be belittled, you'll not be talked down, where someone will listen. There was this interesting thing about, I think last Saturday or so, I went to have a conversation with just ladies.
Okay.
They were having, I think the workplace organized something for them, and at some point through the discussion, it's like it came up and I wanted to tell them what men want. What do we want as men? And
Yeah.
I wanted to tell them. When I started talking about what we want, some of them were saying no. I'm a
Right.
man. I'm telling you what
Yeah.
we want.
Yeah. And they're telling you what you want.
And they're saying no. And this is not the first time I've had that reaction. So really, someone men talk,
Yeah.
but they know where to go.
Mm.
And usually men talk not to cry, but men talk to find solutions.
But
Sometimes
is it not all right to cry as a man?
no, it's okay.
Yeah.
It's okay.
Mm.
And men cry quietly.
Mm.
So you may find a man go into his room and break down on his bed and cry
Yeah.
with nobody knowing.
Mm.
A woman is likely going to someone and cry on the person.
Yeah.
But men are likely not to do. We cry, but we do that
Yeah.
in secrecy.
Yeah.
Right? I think the societal thing makes it a bit more difficult. And again, I think that the health of men hasn't been paid attention to over the years.
Mm.
So if you look at the Millennium Development Goals, there is a whole portion for women and kids, but there's no portion for men.
Yeah.
Right? And so generally, I think those are some of the issues.
I mean, it's really sad because I feel like as men as well, we need to make it create a space where we allow our friends to talk to
Yes.
us. Even sometimes I feel like, and also you'd be surprised once you start opening up to your male friend, that's when he also start opening up to you. It's just like a deal breaker for men. Do you know what I mean? Like for men to open up. But when you do it first, so I feel like people should always, even if their problem are not really like that solve a problem, if you really think about your friend, if you really care about your friend, sometimes you should open up to them to give them that opportunity, or that encouragement to come to you and talk to you, So say if people are going through something, as you just explained earlier, there's a lot of like agencies, like in regards to mental health, there's a lot of agencies. How would I know the right place to go, to seek help?
So walk into any hospital. In Ghana now, it's so easy.
Okay.
Now, because of government policies over the years, no party in particular, over the years, there have been all kinds of policies that has been put in place.
Okay.
Right. And so Ghana now, we have a very, very solid kind of mental health thing, and there are a lot of mental health organizations doing a lot. So now walk into any hospital and ask to see a mental health worker. So either there's someone there who has been trained to handle issues, or they know where to refer you to. It's that easy.
Okay.
Right. So walk into any hospital, any health facility, and ask to see a mental health worker. And they are there.
How would I be sure whoever I'm gonna talk to, I can trust that person?
We are professionals.
Okay.
You see, that is why going to the hospital is safer. A lot of people use the title counselor. They are not counselors. They have not been trained.
Okay.
Right? They don't have the qualification. You see, so the safest place is to go to hospital and ask to see a mental health worker. Confidentiality is key.
Yeah.
I have clients and you sometimes you don't even remember what they came to tell you. Imagine you taking in everybody's problem. You will die before they die. Right? So we hardly, and confidentiality is key. It's part of the requirements for our training. And if anybody leaks your information without your permission, you have every right to sue the person. We don't discuss. Even if you want to talk to another colleague, you need permission from the patient.
About the patient's
Yes,
issue.
you can't just get up as a doctor or a psychologist and just even call your own colleague to discuss a client's without their permission. That's how confidentiality is.
Okay.
Even in the same hospital, you can't discuss with another colleague without asking permission from the client.
Oh, okay. All right. So everyone should feel free. Just, if
Oh,
you are
yes,
going through
yes.
it, just seek help,
Yes.
because that's the only way you can solve the problem, because either you talk to people or you seek professional help.
Yes.
And how do you see the mental health industry in Ghana?
Oh, it's growing.
Yeah.
Now people walk into hospital and say, I want to see a mental health worker. Those days you won't find that, but now it's become very, very good. Now there are all kinds of clinics springing up. Almost every hospital you go, there's a unit there that deals with mental health worker. So I think that is, though we have a long way to go, but comparatively with other countries, we are way ahead. Now there's consideration of even adding into national health insurance and all that. Some insurance companies have actually started and all that. I know Acacia is doing well with helping with mental health issues. Acacia Health Insurance, I'm sure. Yes, there are others who are doing well. So I think we're on the right path.
Is it expensive to
It's not. It's a specialist care, and it's cheaper than other specialties.
Okay.
Usually between 100 to about 500, depending on where and who.
For a session.
Yes, and the level of the person attending to you.
Okay.
You see, but generally some will do pro bono, some as low as 50 cedis, 70 cedis to see it, and we spend more time.
Okay.
But generally between 100 and 500, depending on who and where.
Yeah.
And the kind of service they are. But it's just like any other specialist care.
Okay.
We spend more time. We don't charge as much as, yes.
Okay.
One session will not less than 1 hour. But depend on the volumes of patients to see you at the time.
Yeah.
And where you go, sometimes 3 hours and you are just with one patient. Yes.
Okay. So thank you so much. I feel like we need to do this, from time to time. Maybe we can pick a topic and talk about, mental health from time to time, because I feel like we need to create awareness, for these things. Because when it's really sad when you're reading, or when you hear these stuff like, men killing themselves, or people, not even just men, people, going through all this, trauma, and they have to deal with it themselves, within them, and it becomes like it's sort of like a build up, and then one day you just explode, by just doing something stupid to yourself. So it's always very important that, we seek help, and then we also help each other. So thank you so much for coming. Is there anything that you want to say that I didn't give you the opportunity to say?
Well, I would say thank you to you for the work you're doing. It's not easy.
Yeah.
Getting people you're doing a good job. I'm praying it to grow and grow.
I hope so.
And don't give up regardless. I think that will be my last word. I think you deserve it.
Thank you so much. Thank you guys for watching. See you on our next episode.